Hello, and welcome to this micro learning lecture. We will be discussing Giddens and the concepts that you are going to be exposed to. So let me share my screen here. Okay. All right, so this is just going to be a quick synthesis of Giddens. And remember, there's quite a few chapters here that you have to read. And the key is um, take notes so that way you can retain the knowledge and apply it. So in this quick micro lecture, you will be exposed to the 6 overarching concepts for all WCC nursing courses. And like I said previously, we have 4 concepts. So concepts 1 is nursing 108, concepts 2 is nursing 128, concepts 3 is nursing 138, and concepts 4 is nursing 288. So because you are already a practicing LPN, you will have to complete this nursing 134 transition course. And then in the fall semester this year, you will transition into nursing 138, which is concepts 3. And then the winter semester of 2023, you will transition into nursing 288, and that is the 4th concept. So you will be all done and you will graduate May 2023. Wow, 1 year from now. So with this quick micro lecture, the learning outcomes here are, know the difference between a registered nurse and other members of the healthcare team. So you guys are already working as LPNs. You're probably working with dietitians. You're working with a practitioner. You're working with a CNA. You're working with a social worker. So just remember, it takes a team to care for the patient as well with different specialties. So as we understand these concepts and we apply them, look around here and see what you can apply from your experience. So we'll talk about the framework of the nursing practice, and then we'll talk about attributes of professionalism in writing, speech, action, dress, and interaction with simulated clients and other medical professionals, mostly in lab. So this is a quick visual of the 6 overarching concepts. As you can see, we have patient-centered care, evidence-based practice, safety and quality, information technology, professionalism, collaboration, and communication. So like I said in previous micro lectures, look at the nursing program handbook, right? That is all the policies, everything you need to know about the program. So our nursing faculty decided to go with the QSIN concepts, right? And these are the 6 framework that our program goes by, right? And then at the end of the program, we're hoping that the student learning outcomes are met. And these are all of the outcomes. So provide patient-centered care across the lifespan. So just remember, with these concepts, you're learning from birth all the way to very old age and death, right? Collaborate and communicate effectively with the patient, family, and healthcare team. Number 3, provide safe patient care and participate in processes that maximize quality of patient outcomes. 4, utilize informatics and technology to increase communication, decision making, knowledge management, and error reduction. 5, use evidence-based clinical judgment when providing care to patient families throughout the lifespan. And 6, demonstrate professionalism expected of registered nurses, adhering to the current standards of practice and exhibiting beginning leadership skills. So the concept of professionalism, which is the first concept, is what does it mean to you as an LPN becoming an RN related to the professionalism? So as LPNs, you guys underwent in your LPN program professionalism and leadership as well. But now what does it mean at the RN level. And some of you are probably thinking, well, it means the same, right? So, not really, because just remember, as a CNA, the LPN is over the CNA and unassisted personnel. And then as an RN, the RN is under the physician and over the LPN, and can delegate to the CNA as well. So again, it's a stepping stone. So that's where the recognize that as an RN, you are part of this interprofessional care team and must collaborate in a professional manner. So remember, all these other groups will look to you as the registered nurse. So I'm not sure how many of you as LPNs participate in the care team. So usually that team is composed of a dietitian, a practitioner, medical doctor, either a nurse practitioner, PA, um, a social worker, everyone from management. So that way you can review the care plan, you can discuss the patient's plan, and hopefully meet the outcomes. Okay, so here is what the IOM identifies. So, what nursing recommendations are published in IOM's report. So, kind of look at that, read that, think about that, and see what you think. We do have a team steps video that we want you to view. And when you view that, kind of answer these questions, right? Because you might not know what S-bar means. You might not know what huddle means. You might not know what cuss means. So just look at that video and understand the different types of communication and collaborations that are utilized. And then we do have a question here for you as well. So again, which patient scenario describes the best example of professional collaboration? So we're looking for the team. And then patient-centered care, right, that guides all clinical decisions with respect for culture, spiritual, and dignity. Involves receiving feedback from the patient and their loved ones at their level. And there's a video for you as well to understand that. And now we have the concept of evidence-based practice. So just remember, it is the best evidence based on research for the best patient outcomes. And now we utilize the clinical judgment model. So that is composed of 6 steps. Any cue recognition, analysis, we prioritize, we generate solutions, we take actions, and we evaluate outcomes. So previously, probably in the nursing program, you were exposed to ADPI, right? Which is assess, diagnose, plan, implement, and evaluate. Right now, we're going towards clinical judgment, and that was the 6 steps that I verbalized. So here's a question to just help you kind of get back in that mode of testing, right? But using this clinical judgment model to understand and answer these questions now. And then the safety and quality, like I said earlier, those 6 overarching concepts are based by QSIN. So that's the quality and safety education for nurses. And that's what we go by. But remember, when it comes to safety and quality, we're regulated by the Joint Commission, right? And then we follow the IOM as well. So we follow what the literature says. So a sentinel event, what do you think that is? I'm just going to pause and let you think about it. Okay, so I hope you were thinking and you wrote down that it's an unexpected physical or psychosocial or even death. It's an event that occurs that leads to either some physical harm, you lost a limb, some type of psychosocial stress or effect, and death, if it leads to death. That is described as a sentinel event, and it requires immediate investigation. All right. And then the Institute of Medicine defines a near miss an adverse event. So a near miss is an error of commission that did not that the registered nurse did not provide, but there was no harm to the patient. So either the wrong drug was administered, but there was no reaction from the patient. So that is a near miss. However, an adverse event results in unintended harm in an act of omission. And then you have mitigation, which results in a lethal dose that was given, but the nurse caught it in time and gave an antidote, right? So let's say that the nurse gave an IV infusion of heparin in a bolus, right? And the nurse realized that it was the wrong dose and decided to call the physician, get the antidote, which is protamine sulfate, and administer that to reverse the effects of the heparin. All right. So learning outcomes, we're hoping that by the end of the module, you understand the framework, you understand the role of the registered nurse with the healthcare team, and then also the attributes, right? So remember, as a registered nurse, every time you document, other professions read it, right? So you got the medical doctor reading your note, your progress note. You have um, the charge nurse, you have the director of nursing, you have the dietitian. Everyone's reading your notes. So your writing as a registered nurse, your speech, right? Your actions, your dress. Well, we wear uniforms, but everything should exhibit professionalism, the way you act with other personnel as well. So in the module ticket to lab that you have to submit by Tuesday, which is May 10th by 5 p.m., we have these questions as well. So explain a root cause analysis, right? Include who, what, when, and how. And then explain the ISMP and its role in patient safety, and write down something you learned from the quarter watch report. So everything in the website and the links are in the Microsoft Word document. And then explain and give an example of an event, a adverse or sentinel event. Technology and information. So the VA was the first to adapt the electronic health record in 2016. And, you guys probably use a different EHR, right? Electronic health record. I know there's Epic, right? There's what does the nursing home use? Gosh, I can't think of it, but it's different, right? So the University of Michigan Hospital uses a different one. St. Joe Hospital uses a different one. And unfortunately, um, that's not good for the patient, right? Because these electronic health records don't communicate with each other. So when the hospital discharges a patient to the nursing home, there's a little packet that comes with the patient, right? Because the nurse from the nursing home cannot access the hospital EHR system, right? So typically, I'm hoping that in the future we can work on something that everyone can access, kind of like your vaccines, right? It's on Micker, everyone can access it, so it's a universal um, database. All right, so just remember that most of the quizzes that you're going to be taking in this course will come from Giddens and some will come from Claywell as well. The case studies and the simulations that you guys will be conducting in the lab will also include questions in your quizzes and exams. So the quiz that you guys will be taking on Tuesday, pay special attention to pain, right, in the role of the registered nurse. So delegating, the role of a new nurse, um, pain management. So what kind of medications are you administering during post-op, right? If your patient exhibits um, diabetic neuropathy, right? What do you anticipate the practitioner to prescribe? Um, and most of you know Neurotin, right? That's the most common one. So kind of look at that, review that. I do highly recommend that you go to your public library. You pull a or borrow a NCLEX book from them and you start working on those questions. We do have a ton of questions in ATI as well, but just kind of start practicing. Start doing at least 50 questions a night so that way you can get back in that test mode. All right. Okay, so after this video, you can view all of the PowerPoints. So I have all of the PowerPoints attached. So the first one's leadership. So you can read and take notes on that. And then I will see you Tuesday. All right, thank you. Take care.